The primary mechanism of action of benzodiazepine is facilitation of GABA-mediated chloride influx. Select the drug that antagonizes diazepam action non-competitively. Bicuculline. The following drugs exert their action through GABA benzodiazepine receptor chloride channel complex except baclofen. At single hypnotic dose, the pharmacokinetics of diazepam is characterized by slow elimination with marked redistribution. At a single hypnotic dose, the pharmacokinetics of diazepam is characterized by slow elimination with marked redistribution. The following is a very potent and short-acting benzodiazepine whose use as hypnotic has been noted to cause psychiatric disturbances in some cases. Triazolone. Which of the following statement is not true of zopiclone? It does not act by potentiating GABA. Choose the drug that has been found to be more selective for the omega-1 subtype of benzodiazepine receptor and produces hypnotic action but little anti-anxiety muscle relaxant or anticonvulsant action. Zolpidem. Zolpidem differs from diazepam in that its hypnotic action shows little fading on repeated nightly use. Diazepam is indicated in the following conditions except generalized tonic-clonic epilepsy. The following drug is used to reverse the CNS depression produced by diazepam. Flumazenil. Select the correct statement about flumazenil. It has no CNS effect of its own but blocks the depressant effect of diazepam as well as stimulant effect of beta-carbolines. The general principles in the use of hypnotics include the following except in patients with chronic insomnia, a hypnotic should be used regularly. Which of the following is not a CNS depressant but increases the tendency to fall asleep at night? Melatonin. The barbiturate having higher anticonvulsant sedative activity ratio is phenobarbital. The most probable mechanism of action of anticonvulsant action of phenytoin is prolongation of voltage sensitive neuronal sodium channel inactivation. The following anti-epileptic drug is most likely to impair learning and memory and produce behavioral abnormalities in children. Phenobarbital. Phenytoin appears to derive its anticonvulsant action from selective inhibition of high-frequency neuronal discharges. The characteristic feature of phenytoin pharmacokinetics is capacity-limited metabolism saturating at higher therapeutic concentration range. The following adverse effect of phenytoin is related to high plasma drug concentration. Ataxia. The following drug displaces plasma protein bound phenytoin as well as decreases its metabolism. Sodium valproate. Carbamazepine possesses the following property not shared by phenytoin: raising threshold for fentanyl tetrazole conversions. Select the anti-epileptic drug that is effective in manic depressive illness as well. Carbamazepine. The following anti-epileptic drug is likely to cause hyponatremia as a side effect, especially in elderly patients. Carbamazepine. The drug of choice for trigeminal neuralgia is carbamazepine. The following statement is not true of carbamazepine. It is not effective in complex partial seizures. The following anti-epileptic drug raises fentanyl tetrazole seizure threshold but does not modify maximum electroshock seizures. Ethosuximide. The anti-epileptic drug which suppresses maximum electroshock as well as Kindle seizures raises fentanyl tetrazole threshold and is effective in both generalized tonic-clonic as well as absence seizure is sodium valproate. Select the drug having a narrow spectrum anti-epileptic activity restricted to absence seizures. Ethosuximide. Sodium valproate has been shown to prolong neuronal sodium channel inactivation, attenuate T-type calcium current in neurons, inhibit degradation of GABA by GABA transaminase. Sodium valproate should be used with caution in young children because they are particularly at a risk of developing the following adverse effects hepatitis.